Which hormone is primarily responsible for the development of the endometrial lining during the menstrual cycle? B. Estrogen. At what gestational age is the fetal heartbeat typically detectable via Doppler ultrasound? B. 8 weeks. The most common site of ectopic pregnancy is B. Fallopian tube. Which vitamin deficiency is most associated with neural tube defects? C. Folic acid. The most common cause of primary amenorrhea is A. Turner syndrome. Which of the following is a contraindication to the use of combined oral contraceptive pills? D. All of the above. The most common benign ovarian tumor is C. Dermoid cyst, mature cystic teratoma. Which is the most effective method of sterilization? B. Hysterectomy. The Bishop score is used to assess B. Cervical favorability for induction of labor. Which condition is characterized by the triad of hypertension, proteinuria, and edema in pregnancy? A. Preeclampsia. The primary goal of obstetric anesthesia during cesarean section is D. All of the above. The most common cause of postpartum hemorrhage is A. Uterine atony.
The term primipara refers to a woman who
A. Has given birth once. Which contraceptive method involves the use of a small flexible device placed in the uterus? B. Intrauterine device, IUD. The most common type of ovarian cyst in reproductive age women is A. Follicular cyst. Which is a sign of placental abruption? A. Sudden onset of abdominal pain and bleeding. The primary purpose of oxytocin administration after delivery is to D. All of the above. Which condition is characterized by excessive growth of the endometrial tissue outside the uterus? A. Endometriosis. The most common cause of secondary amenorrhea is A. Pregnancy. Which procedure is performed to evaluate the uterine cavity in cases of abnormal bleeding? A. Hysteroscopy. The typical presentation of a patient with polycystic ovary syndrome, PCOS, includes A. Irregular menses, hirsutism, and obesity. Which of the following is a common feature of menopause? D. All of the above. The most common cause of abnormal uterine bleeding in women over 40 is A. Endometrial hyperplasia. The definitive diagnosis of uterine fibroids is made by D. Histopathology after hysterectomy. The most common bacterial pathogen causing pelvic inflammatory disease, PID, is B. Chlamydia trachomatis. During labor, the station of the fetal presenting part is measured relative to A. Ischial spines. The most effective way to prevent mother-to-child transmission of HIV during childbirth is D. All of the above. The primary surgical treatment for severe case of uterine inversion is A. Uterine replacement. Which of the following is a common complication of an episiotomy? D. All of the above. A risk factor for gestational diabetes includes D. All of the above.